Simmons-Massey received her doctorate of nurse practice in 2013, Master's of Science in Nursing 2005, and Master of Science in Nursing 2002 from Temple University in Philadelphia. Her 20-plus year nursing background includes bloodless medicine and surgery, heart failure, emergency medicine, gastroenterology, and critical care. She serves as adjunct faculty at Thomas Jefferson University and Holy Family University, teaching advanced health assessment and advanced pharmacology for advanced practice nurses. As both clinician and researcher, Dr. Massey works along with the project management office and other physician leads on hospital-wide quality initiatives to improve physician ordering practices and their impact on patient outcomes. She is instrumental in educating both physicians and nurses in the field of patient blood management and the care of patients for whom blood is not an option. And without further ado, I present Dr. Simmons-Massey, and she will start her presentation now. Thank you.
So Nicole, first I want to thank you for that introduction. My talk today is centered around patient blood management as well as bloodless medicine and surgery. Some of the objectives for this lecture are to discuss the importance of empowerment, advocacy, and to really look at some of the adverse associated outcomes with transfusion and the benefits of patient blood management and bloodless medicine and surgery. Equally important as a clinician is being very empathetic to patients as well as their families. So why is empowerment so important? Well, when you think about it, according to the World Health Organization, it's so important for patients to have control over their own personal decisions, as well as their actions that affect their health care. So when we allow patients to take co-responsibility of their care, this really helps to empower the patient because, for one, they're more aware, they're much more willing to be compliant, their knowledge base has increased, and they have a lot more autonomy. So what I try to do as a clinician is make sure that a patient has co-responsibility of their care so that we can really individualize this care and address the needs of the patient specifically. This involves a lot of patient involvement, and again, it's more patient-centered shared decision-making. So I consider myself an advocate. And the reason why is because when I'm working with patients, I really want to give them a voice to understanding their care. Sorry about that.
Anesthesia stat, block pavilion, room 64 east. Attention please, anesthesia stat, block pavilion, room 64 east.
Sorry about that. So we want to give the patients a voice. And also, when you think about the healthcare system, it's so complex and layered that we want to make sure we assist them and navigate them through their care. And how do we do this? By providing adequate resources. One of the things that's most important to me is educating patients about their rights and also making sure that they're aware of their healthcare options. I do this by way of providing information and providing support with the patient in making those decisions. And I really thought this cartoon was pretty nice because in that quote it says, to prevent errors in your care, it's so important to ask questions. Well, what do you want to ask questions about? Your medication, the test that you're taking. Why is this treatment option important to you? Keep in mind, it's your health, so please speak up. So when we talk about blood transfusion, the old traditional concept was that blood products were effective and an acceptable therapeutic intervention. And according to the Red Cross, blood is the gift of life. However, as we start to study medicine, we've moved into some new concepts. And we look at blood and the utilization here at Temple as to whether or not we're using it appropriately to save lives in instances such as trauma or when a patient is hemorrhaging. But patient blood management is different in the fact that we look at the appropriateness and the use of blood based on true evidence, not on just numbers. So we have to keep in mind that transfusion can result in some pretty undesirable outcomes for patients. So there's no true evidence to prove that transfusion is truly beneficial for regular patients. So before we go any further, it's important to understand a little bit about blood components and how blood works. When we come here in the lab, we do something called centrifuging. And what it does is it'll take the tube of blood that's drawn in the hospital and it'll separate it into 4 major components. So 1 tube of yellow blood that we had, once we spin it down, it's actually separated out. Part of the blood component is plasma. And what plasma is, it's a protein and also clotting factors, which are really important when you have a bleeding situation. Another component of blood are white cells. And what white cells do is they help defend the body from infectious diseases and foreign materials. Platelets, however, help when a person is bleeding to clot off the blood. Now, the main thing that I'm focused on today is primarily red cells. And the reason why is because red cells are which carry the hemoglobin, and they're responsible for perfusing not only the heart and other organs, but also the tissues. So this is how we look at labs here. Suppose you have a high white count. Well, that's going to make me as a clinician think, does this person have some type of ongoing infection? Are they in a state of inflammation? What can we do to address this issue? What will be required? And on the same token, if I see a massive drop in the red cells, I'm going to question myself to see, is this patient bleeding? Is there some underlying cause? Or maybe perhaps this person has some chronic anemia going on. So whatever the case may be, the labs that we pick up are which guide our care. But as far as blood transfusion though, the reason why I educate patients is because even thinking about a blood transfusion is so serious, and there's many adverse reactions. Now, during surgery, the research shows that intraoperatively, even 1 unit of packed cells, I am so sorry about the interruption.
Floor from 634, anesthesia set, Rock Pavilion, 6th floor from 634, anesthesia set, Rock Pavilion, 6th floor from 634.
Well, as you can see, I'm very busy here. But anyway, back to the presentation. Intraoperatively, even 1 unit of packed cells can statistically cause a significant complication. Some of those complications are pneumonia, infection, stroke, even a heart attack. So although the general population may view blood as life-saving, look at the potential for adverse events and think about whether or not this treatment modality is something that you would want to have. In addition, plasma and platelets, which I explained in the previous slide, although they have some benefits, we have to keep in mind that too much fluid can cause circulatory overload, where your heart is just pumping against way too much volume. In addition, there's something called acute lung injury, where the lungs are affected by too much volume in blood. And another serious reaction is an allergic reaction, because keep in mind, we're so different genetically. None of us are the same. So if your body has antibodies and then we transfuse that blood, there's a high potential for a fatal anaphylactic reaction where the person could potentially die. In addition, with platelet transfusions, this has been associated with multi-organ failure, acute lung injury, like I mentioned before, and bacterial sepsis, which could just simply be from us housing the blood in the blood bank. So surely blood is not without risk. So what are we asking you to do as healthcare consumers? Make educated choices. Choose wisely. I mentioned before that we have a patient blood management team here, and what we do is we try our best not to even use transfusion. The normal hemoglobin for a female is about 12 to 15, and males is a little higher. So as you can see from this learning material, we don't even look at transfusion until someone loses almost half their blood volume, which is about 7. So we should not be using blood unnecessarily. We don't want to use blood to correct iron deficiency. That would just be a total disaster. And the other thing we don't want to do is just use blood to reverse any kind of bleeding disorders, because we have options of using various vitamins, and that's what I'm really going to get into. So the whole goal of this slide, which will be available to you as an educational piece, is to avoid blood transfusion at all costs. This is a precious resource in the minds of many, but there's no need to transfuse patients unnecessarily. So now this is what I love and enjoy, patient blood management. Why is it so important in this age and time? Because it's evidence-based. And if you look at the word patient blood management, you'll see that the evidence is moving towards minimizing the use of blood and not even using blood at all. The whole goal is to use the patient and optimize the patient and not utilize transfusion, which could lead to some of those adverse events I talked about. And patient blood management, the interesting thing about it is it uses a lot of bloodless medicine principles to reduce or eliminate the need for transfusion, not in some patients, but in all patients. And the literature shows that it actually improves outcomes and it lowers healthcare costs. So what do we try to do? We strive to optimize the patient's hemoglobin by educating our clinicians, using a restrictive approach, and trying our best to use the patient's body as our resource to replicate those blood cells. So when you think about the benefits of patient blood management, there's many. For one, we're not exposing that patient to donated blood, which we already talked about before in the previous slides, that can result in adverse outcomes. Also, we found in the literature and in the science that it does improve patient outcomes, and there's a shorter length of hospital stays, and overall, the costs are also reduced. And we know with the society we live in, the cost is definitely a factor. So look at all the benefits when we reserve not using blood and we use the patient's own body. Several benefits. So bloodless medicine and surgery is really my true baby. I've learned so much in this position here at Temple Hospital, having this formalized program, because with bloodless medicine and surgery, blood is not an option. So what do? We work as a multidisciplinary team, and we look for the safest, most effective care without the use of any blood transfusion. So what does this require? Definitely requires meticulous medical, surgical, and pharmacological means to provide the best possible care. And it's a very organized approach to patient care. I've had people travel from all over the world looking for bloodless medicine to avoid the use of transfusion. Now, I must admit, my primary population that I care for here at Temple are Jehovah's Witness patients. And one thing about this population is that they will not accept blood under any circumstances. And this is because of their religious belief. Others come to my center because of personal preference. Perhaps they've had a reaction before, or a family member that had an adverse event, or some people just don't want blood at all, and that's okay too. But again, it's up to us as clinicians to be skilled and ready to address those complex cases. So what I wanted to do briefly was talk about some of the pillars of bloodless medicine and surgery, because as I mentioned, I love this job. And one of the things that's important is that we minimize blood loss. We want to optimize our tissue oxygenation and manage our anemia. Anemia, why is this so important? Well, believe it or not, anemia affects over 2 billion people worldwide. And sadly, as African Americans, we are 2 to 3 times more prevalent to have anemia. Perhaps it's because of fibroids or pregnancy, vegetarian diets. All sorts of things can cause anemia. But with anemia and being in an anemic state, it's really not a good situation because you're fatigued, you're tired. Some people experience dizziness, some short of breath. And people walk around all the time anemic and they don't even realize that they're anemic. So this is something definitely that we want to look at. So when we have patients come in, before we even think about surgery or doing anything invasive, part of the bloodless medicine track that we do is we really look at those medications. And oftentimes when I have people in practice, I say to them, what medications are you on? And sometimes, especially the older population, they take a lot of herbs and various supplements. So even if you're taking herbs, something as simple as garlic or aspirin or Motrin, you must make your healthcare provider aware because there's a high potential for bleeding, a high potential for adverse reactions, especially if you're going to be a surgical patient. So something as simple as vitamin E can cause blood thinning as well. Some of these other things that are listed are just medical modalities that we use in the hospital, but we want to know about your history. Have you ever had a lot of bleeding after surgery? Any kind of bleeding disorder such as hemophilia? What supplements do you take? So please include them all so that we can stop them prior to surgery. Equally important from my perspective is doing a thorough screening. Screening is important for us to know if you're anemic, because if you are, and it's an elective surgery, we can handle that beforehand. So if you do lose blood, there's no need to rush and try to ever use that. And for my blood refusal patients, that's not an option. So for me, it's really important to be meticulous. So with preoperative anemia, we handle it. We ask about history, contributing factors, all those things. Now, your body is so complex, but it needs iron in order to make this protein called hemoglobin. And hemoglobin is found in the red blood cells and responsible for transporting oxygen to your lungs and to your tissues and the rest of your body. So if you're iron deficient, then the hemoglobin is going to drop and lead to iron deficiency anemia. If we don't have enough healthy red cells, we're going to damage our organs and not even make enough blood, and we're going to put so much stress on our hearts, which is never a good thing. So yes, even though anemia sounds simple, it can have adverse events, so we need to manage it and address it. So I mentioned the number of people that have anemia. Again, those signs and symptoms might be fatigue, weakness, shortness of breath, and even an irregular heartbeat. So don't go around and not realize that there's a high potential, given the numbers, that you too might be anemic. So this is something that you want to discuss with your healthcare provider so that you're in a more healthy state. Don't blame your fatigue on just being overworked and tired. It could be a high possibility that you're anemic. So how do we manage anemia here? I'm a little bit of a health buff, and I think that we can get so many things from healthy foods and good nutrition. Also, some of the supplements that we use here are things like vitamin C, B12, folic acid. Sometimes we have to go to some medical key strategies and use things that will stimulate the production of red blood cells. And one of the medications we use is called erythropoietin. In addition, there's times when I'm consulting with the hematology team and we have to utilize IV iron to build those stores up pretty quickly. The other thing I try to do, especially when people are hospitalized, is minimize the amount of blood that we draw from patients, because sometimes patients come in fine and we make them more anemic. So with this next slide, what I'm going to do is just go over a couple of different food options that would be helpful. And to me, they're great fruits. We have fruits like bananas and apricots, some blueberries. And I love greens, so I like greens a lot. I eat a lot of greens. Spinach, things like that, bananas, chia seeds. There's so many things that are nutrient dense that our body needs to produce the right amount of hemoglobin to perfuse our important organs. This is just a little slide that shows what we do inpatient using those various medications. So suppose I do have a blood refusal patient or just a regular patient who outright does not want transfusion for religious reasons. I mentioned Jehovah's Witnesses or some other reason for personal reasons. Some of the things we use here are things like folic acid. I mentioned that before, the IV iron. And with the folic acid, it's a water-soluble form of B12. And these vitamins are essential for producing healthy red cells and helps with the proper functioning of the nervous system as well. So don't forget about meats, fish, and poultry, because those two can be beneficial. And people who are perhaps vegetarian have to really watch it, because by them not eating meat, they can also be anemic. So these other things that are listed on the screen are things that help us to stop clotting. But rather than using those components of blood that I mentioned, there's so many over-the-counter things that we can use and so many fractions that we can use that are simulated in the lab, and also different fractions that we get from the full components. So there are other options. Patients just need to be educated. So what do we do during surgery? That's an interesting question. Well, what we do is we utilize something called acute normal volemic hemodilution. I describe it as you got this big cup of juice and you pour the whole cup of juice out. We're going to make it red, right? So we take that blood away and we collect that blood before the surgery. And then this is right there with the patient real time. It's not stored somewhere getting all kinds of bacterial contamination. This is your precious blood. We collect that blood before surgery. We restore it with something called normal saline or another volume expander, perhaps Ringer's lactate. Once the bleeding stops in the surgical field, we take your own precious resource, your own blood, and return it to you as the patient. And this is done in a closed system. So acute normovolemic hemodilution is an excellent option when there's going to be blood loss during surgery. A similar modality we use is called cell salvage. So if you look at the way the picture is formed here, blood is taken from the surgical field, maybe a big open abdominal surgery where you're bleeding a lot. We collect that blood, but because it was an open field and it was a surgical field, we then filter that blood. We wash that blood. And in this case, we're not giving you back the whole blood like we did in the previous slide, but we're giving back your red blood cells at the end of the procedure. Again, ideal in a big high blood loss surgery because we're utilizing your blood as a precious resource. So question always comes to me, well, I'm not so sure about not receiving blood. Do bloodless patients experience worse outcomes? Absolutely not. You can check it in the literature. Blood refusal patients have similar outcomes with respect to morbidity and mortality, similar or reduced healthcare costs compared to conventional management. And when a proactive approach is taken and we use the right treatments and we plan and we're meticulous, bloodless patients' mortality rates are actually lower. Isn't that something? So it definitely makes you think and pause. Now, one thing I always tell my colleagues is that by law, there's something called the individual patient decision. And according to the Federation Patient Self-Determination Act, every single patient, including myself and you, have a right to facilitate your own healthcare decisions, a right to refuse medical treatment, and you have a right to utilize your advanced healthcare directive. And as a clinician, I have to respect your care, your dignity, your privacy, and your right to informed consent. So that is so important, and you are empowered to be educated and make your own choice. And me as a clinician, I have to respect those choices. So I think along this realm and this path that I've taken, what makes me feel so happy about the work that I do is my ability to be empathetic. For me, it's so important to understand and share those feelings of my patients, to allow my patients to express their feelings and their emotions, to listen intently and understand the situation, the behaviors around what's going on, so that when I'm addressing those needs, I can be very active, very supportive, and very targeted to what their needs are, not mine. With patients, they know their bodies. They know what their needs are. So it's my job to understand what's going on behind the emotion. I have to understand body language. I have to understand facial expressions. And this is the reward of healthcare because we're working together as a united team. So I talked about this human connection. And if you could stand in someone else's shoes, hear what they have to say, see what they have to see, feel what they have to feel, would you treat them differently? The most important thing in healthcare is to support individual choice. Another important component is to offer the best possible care within the confines of the patient's beliefs, choices, and wishes. And then the third thing is to be educated, both the clinician and the patient, so together we can collaborate and give the best care. So this is just a short video that I'd like to watch. as you can see from the moving video we just watched, it's all about collaboration. It's all about support. It's all about putting the patient first, but most importantly, having empathy, educating them, giving them a voice, and making sure we work collaboratively as a team. And the result will be good patient outcomes. Thank you so much. Thank you guys so much for some of the kind words. Thank you guys all for attending. I see the nice comments in the chat box. Thank you again. I've used my allotted time. I really appreciate the support. You guys are all wonderful. And if you ever have any questions about bloodless medicine, need any kind of direction, I'm here to support you through the process. So thank you again, and you enjoy the rest of the conference. Thank you so much. Take care.